Question number 7, how you manage my pain. A lot of times people say, "Oh, doctor, I'm fine. I have no pain." Well, the goal is to never feel pain, right? That you don't wait till you have pain and say, "Let me do something about it." That's just not the best approach. What typically happens is most of the patients we see, their cancer is pretty advanced. Typically, it's like a difficult cancer to even know you have. So by the time someone has like a symptom, like maybe their eyeballs are turning yellow, or maybe they can't breathe, as well as they used to, like something is pretty advanced in their body, and then they get a symptom that says, "Oh wait, I better go see a doctor." And then by the time, doctor then is meeting with them and says, "Hey, look, you have this stage 4 type of cancer," it very quickly goes downhill fast, where they feel okay, and then they have some loss of function, and now they have pain. And the reason why I put in this question 7, in a standard of care world, opioids are the primary way they manage pain. And opioids, the challenge with that approach is that they're ultimately dead ends. So I'm not saying you can never use them. I'm not saying don't use them. I'm simply saying is you got to have other ideas and other strategies, because if that's the only one used, you're going to get to a point where no amount of morphine or codeine solves a problem. And then what are you going to do? And then what happens typically, once people reach unbearable pain, their goal is just, hey, just let me die. Don't let me keep experiencing this amount of pain. And for loved ones, it's really, really difficult to watch someone you love suffer. What usually happens then is, instead of everyone saying, "Hey, let's beat cancer," they transition to, "Hey, let's help them die peacefully." And what happens a lot of times is that the pain could have been better managed at the beginning, and that person could possibly have survived because they could have been strong enough to handle treatment and something. And so there's a lot of ways to use exercise to reduce pain. There's a lot of ways to use breathing exercises to reduce pain. There's all kinds of research in the neurological sciences that talk about different cloths and materials and how it stimulates receptors in your hands and your face that minimize perception of pain. So I'm not talking about like using a drug to block pain. I'm talking about how to improve the ability of the nervous system to strengthen pathways in other areas so that the pain signals are relatively reduced, and then using exercise to strengthen muscles to provide more structural support to reduce like tension or swelling or some of the signals that cause the pain. And so when most people see this stuff, like, holy mackerel, like this is so much better than being drugged up and not recognizing someone you love, or being drugged up and you're sleeping all the time. So there's other options to manage pain is the main point.